Hi, my name is Ardis Watkins. I'm the Executive Director of the State Employees Association of North Carolina, and we have about 46,000 active and retired state employee members. It's a voluntary organization. Our main goal is advocacy. Pay, retirement benefits, health care, these are the critical things to our members. They're central to their lives, to their ability to provide for their families and create a future. The health plan is, in fact, one of the most critical pieces to securing that future for state employees. About 11 years ago, SEANC put out a report, Save Our State. And it was a response to legislators over the years saying, if you want us to come up with the money for state employee raises and things like that, you have to show us where the money is. So we did just that. And one of the clear places where there was money was if we treated the health plan the way we should, where we asked for transparency, where we asked for nonprofit hospitals not to be nonprofit if they were, in fact, mega billion-dollar unrestricted reserve holding entities. To not have working people carry all of the load while hospitals with what they advertise as spa-like birthing facilities, multi-million-dollar CEO salaries, beautiful lobbies, atriums with fountains, opulence. This shouldn't be on the back of public servants, and it is. But this report was put out, and honestly, not many legislators read much of it. There were some big things to come out of it, though. And I know that the General Assembly at the time, this was about 11 years ago again, the General Assembly took what had always been a secret contract between the state health plan and its third-party administrator and agreed to make that public. That shouldn't be a big deal, to make a large public contract public. It was a massive deal. And it shouldn't have been that hard, but it was. That was a great step. We had fought so many battles along the way about the health plan. At one point in time, health plan reserves were even used for hurricane recovery. Health plan reserves. The states made so many choices that demonstrated the health plan wasn't all that important to them. But we appreciated what the General Assembly did then, and there was one representative in the House of Representatives at the time, Dale Folwell, our current treasurer, who dog-eared some pages in that Save Our State booklet. To this day, he's got that booklet. And he is the person who took it to heart, who said, this seems wrong and it seems like something we should look into. All of that hard work since then, we appreciate. We appreciate Treasurer Folwell. We appreciate Dee Jones and her staff, the leadership of everybody in the Treasurer's office, experts like Dr. Ho and Dr. Melnick, who are willing to come forward and say this is in fact wrong. Because 750,000 North Carolinians are in this health plan. That's a lot of people. But the most striking thing about that number is that means 1 out of 10 people in this state who are commercially insured are in this health plan. If we're overpaying in this health plan, if we're allowing providers to keep their prices secret in this health plan, thus making it like the diamond market, some sort of artificially based market, then what's going to happen to healthcare prices all over North Carolina? They're going to stay unreasonably high. And that's exactly what's happened. Our healthcare prices are routinely cited by experts in healthcare economics as being some of the largest in the country in North Carolina. But our outcomes are not the best. We have world-class facilities, but our outcomes are not rated among the highest in the country. There's a problem here. It's a significant problem for state employees and retirees, but this is literally a problem for all North Carolinians. Wall Street is getting more and more involved in buying up these hospitals. You have to ask yourself why. Wall Street's smart. They're going to do what is the easiest thing to make quick money. Providing health care shouldn't be the best way to make quick and secretive money. And North Carolina, hopefully, is taking the lead through the efforts of Treasurer Folwell and his staff to say, not here. You may do that elsewhere, but not in North Carolina. Thank you. I just wanted to weigh in from the perspective of a lobbyist who was down in the General Assembly with the lobbyists from hospitals during the Clear Pricing Project debates. I will tell you that we, in fact, were told repeatedly by hospital lobbyists that they're broke. I mean, they're trying to provide care to rural communities. Didn't we care as an association about poor people and people in rural communities? For goodness sakes, that's our membership. The fact of the matter is, politically, that sounds really good. It sounds like, don't ask me any more questions. If you care about poor people, if you care about people in rural communities, you will stop asking questions. The fact of the matter is this: that's where we've seen hospitals closing because they've been bought up by these mammoth hospitals. That's where we've seen a disproportionate effect on communities of color as costs keep going up and up and up because of what Dr. Ho said. If you keep buying more and more of the providers, you can control the pricing. So it's a game. It's a game to say we have no money. It's been my experience in politics that when folks won't show you what they're charging, they're not charging you an amount that puts them in a poverty position. You can just take that to the bank.